Back in 1972, upon his return from the Army, one of the first jobs Department of Public Health Director James Gillen had on Guam was coordinating the Regional Committee meeting for the World Health Organization.
At that time, it was a smaller meeting, 17 countries at that time. It was held at the newly opened Hilton Hotel. Again, very successful.
And next week, it will come full circle, as for the first time in over 40 years, Guam will once again be host for the 66th session of the WHO meeting. Gillen, who serves as the chairman for this year's meeting, says this time more than 300 people from 33 different countries will be participating, including China, Japan, Australia, Malaysia, Singapore, and of course Guam. As for the topics, Gillen says they will help provide directions for the future.
There's a large number of items that are generally shared health concerns across the whole region. Some of them like viral hepatitis, emerging infectious diseases, universal health care. There is the budget to be determined for the next couple of years.
Other topics include food safety, neglected tropical diseases, and non-communicable disease prevention and control. He adds while there will be international presence, there will also be a One Health approach to not only look into healthcare, but policies in the health environment.
I think a lot of the good thing that comes out of this is just the collegial approach that we get to, again, to network with one another, to talk about our common problems, but then also some unique solutions that are unique to some countries that may be able to work in others.
Gillen, in the meantime, says a lot has changed over the past 4 decades, and that Guam is now being seen more to host big international events, such as this year's Trans-Pacific Partnership meeting over the summer, to the upcoming Festival of Pacific Arts in May of next year.
But this also is, this is a fairly high-level operation. It'll be an opportunity for some people who have never been to Guam to see it, and I think may have them become more interested in developing health systems and agreements and cooperative arrangements with us, because in the region we really do share a commonality when it comes to the health status of the people.
And like the TPP, Gillen says much of the WHO will be a closed meeting.
I know we have some physicians on Guam who were kind of concerned about not being invited. If they'd like to come to observe, we can make an arrangement, but there's no opportunity for them to make any presentations or anything because it's a very full agenda.
The week-long event begins on Monday, October 12th to the 16th at the Hyatt Regency Guam. Reporting for Guam's News Network, I'm Ken Quintaniza.